Hypertension by Ashley Dornetti, Alex Dornetti, Sarah Lehman, Haley Wick, Madeline Parker, Garrett Clifford, Olivia Newfarth, and Haley Kossel.
The first article that we will talk about is about health literacy, and it is from Nursing Outlook. In the past, health literacy was focused on the patient's risk and ability to obtain and comprehend basic medical information regarding their condition. Now, health literacy is a public health focus of promotion of self-care that allows individuals to gain control over their health and to motivate them to understand and use information to promote and maintain good health. In the United States alone, over 1/3 of Americans are health illiterate, meaning they struggle with tasks such as routine self-care management, following discharge instructions including directions with taking prescribed medications, and following pediatric immunization schedules. Focus groups of low health literacy are the elderly, low-income individuals, ethnic minorities, and those with chronic health conditions. The individuals of these groups are more likely to have a lower health status than one with a higher health literacy. The American Medical Association reported that the average annual healthcare cost for individuals with low health literacy is 4 times higher than the cost for individuals with high health literacy. Nurses play a direct role in the promotion of health literacy, as they are at the first point of care and are vital for public health transformation. Nurses have the most contact with the individuals attending public health clinics and with patients in the hospital. They are promoting health, wellness, and the comprehension of care in all aspects of their career. When practicing, you should always advocate for assuming all patients are health illiterate. Encourage patient engagement and health literacy to integrate patient-centered nursing practice into interprofessional practice models. Promote shame-free environments where health literacy can flourish. Use plain language and teach-back method when providing any directions to a patient for self-continuity of care. Develop goals for healthcare professionals to improve health literacy by using evidence-based models that promote patient engagement and comprehension. Encourage community partners to participate in bettering health literacy and developing new ideas to further it. The Heart Healthy Lenore study was published by the National Center for Biotechnology Information. Their objective was to narrow health literacy disparities in hypertension by introducing more interventions to mitigate the impact of the condition combined with low health literacy. They tested if a multi-level quality improvement intervention could improve systolic blood pressure, more so in patients with low versus high health literacy. They recruited 6 study practices in their area, including 5 practices in 1 community health center. The study sample included 525 adult subjects with a systolic blood pressure of greater than or equal to 150 millimeters of mercury, otherwise known as uncontrolled hypertension. For all patients with hypertension, the 6 study practices implemented a visit planner for providers to utilize with their patients at every visit to their office. The planner had the patients and providers address blood pressure goals, blood pressure knowledge, use and review of home blood pressure monitoring together. It also included standardized questions for the provider to ask their patients about their medication adherence to better understand and address patient barriers to adherence at the point of care. Providers also gave patient coaching, motivational interviewing, and helped with goal setting. The primary focus, health literacy, was conducted by recording provider interactions, role play, and reviewing health literacy literature. Patients with uncontrolled hypertension had additional monthly phone coaching. Materials were mailed to the subject's home prior to calls, and use of a home blood pressure monitor and blood pressure logbook at home were implemented. The subjects were encouraged to discuss their logbook at office visits. During the monthly phone coaching sessions, the main topics covered were medication adherence, including side effects, strategies to enhance adherence, discussing which medications are specifically for hypertension, strategies to enhance dialogue with healthcare providers, encouraging physical activity, healthy diets, including DASH diet, portion control, and understanding salt reduction, home blood pressure management, including accurate measurement technique, reviewing the recent blood pressures, addressing blood pressure goals, discussion of relationship of weight to hypertension, addressing social barriers and facilitators to navigate the health system and live well, stress reductions, coping mechanisms, depression, tobacco cessation, and alcohol use. Among the 525 participants included, 493 subjects completed the health literacy assessment and were included in the analysis of the results. Among the 493, 23% received a score of less than or equal to 22, thus categorized as having low health literacy. The low health literacy group subjects had a mean age of 64.8 years compared to those with higher health literacy, which had 54.7 years. The low health literacy group subjects had a higher proportion of males as well. The mean systolic blood pressure was 144 millimeters of mercury at baseline for those in the low health literacy group compared to 138 millimeters of mercury for those in the higher health literacy group. At 12 months, compared to baseline, the mean systolic blood pressure was reduced by 5.6 millimeters of mercury for the overall sample. At 24 months, the mean systolic blood pressure decreased by 5.5 millimeters of mercury overall. Those in the lower health literacy group had an 8.1 millimeters of mercury mean systolic blood pressure reduction, while the higher health literacy group's mean systolic blood pressure reduced by 4.6 millimeters of mercury. While the mean systolic blood pressure reduction may seem unsuccessful, this study used the same intervention approach to both subject groups of low and high health literacy. So there should not have been a drastic difference between the two groups at 12 and 24 months. The goal is to introduce more interventions to mitigate the impact of hypertension and decrease systolic blood pressure, which results show just that.
When choosing a topic for patient education in our specific clinical environment, we first wanted to consider our patient population. Our unit consists of patients from a wide variety of ages. The youngest patient any member of our clinical group has cared for was 21 years old, and the oldest patient that any of us have cared for was approaching 99 years old. Regardless of age, race, or background, one thing that a majority of our patients had in common was their diagnosis of hypertension. We chose to focus our teaching plan on hypertension education due to the fact that this condition affects a high proportion of our patient population. And even if our patient does not currently have hypertension, we can still educate them about what risk factors they may have. Because no matter where someone places themselves on the health illness continuum, everyone can benefit from becoming educated on hypertension prevention. Because we know that modifying the risk factors for hypertension decreases the risk of adverse health events in the future, like heart attack, heart disease, and stroke. We thought that it was very important to give our patients a tangible tool that they can take home with them when they're discharged, because we know that health illiterate patients struggle with the tasks of following discharge instructions and also following directions taking prescribed medications. So in addition to these two tasks, our booklet offers information on what is hypertension, the different types of hypertension, risk factors, dietary modifications, lifestyle modifications, and pharmacologic treatment of hypertension. In consideration of the different levels of health literacy that our patients may express, our guide uses plain language as much as possible. Anywhere that there is medical terminology included in the booklet, it is followed by a simplified definition that is easier to understand. We have not had any personal experiences on our unit with caring for a patient who speaks a different language, but we know that this is very possible, so we could have a translator read our booklet to the patient if needed and get a copy translated to their preferred language. In consideration of patient-centered care, the nurse will bookmark the pages on the medication section that the patient has been prescribed in order to make it easier for the patient to find the information that pertains to them. The nurse will find this information in the medication administration record before providing this booklet to the patient. We have also included a checklist in the back of the book that the nurse or physician can help the patient read through in order to determine what risk factors are applying to them.
Hypertension is high blood pressure. Blood pressure is determined by both the amount of blood pumped by the heart and resistance to blood flow in arteries. It's often called the silent killer because most patients don't experience symptoms. However, even without symptoms, damage to blood vessels and the heart continue to occur and can be detected. Patients with extremely high blood pressure may experience symptoms like headache, dizziness, blurred vision, and retinal changes. To measure your blood pressure, a member of your healthcare team will use a blood pressure cuff to obtain two numbers, which are expressed as a fraction. The top number is your systolic blood pressure, which is the pressure in your arteries when your heart is contracting. The bottom number is your diastolic blood pressure. This is the pressure in your arteries when your heart is resting between beats. Hypertension can be divided into 3 stages: pre-hypertension, stage 1 hypertension, and stage 2 hypertension. It can also be classified as either primary or secondary. Primary, also called essential hypertension, is high blood pressure without an identifiable cause. Typically, this type of hypertension develops over many years. It can account for about 85% of cases. Secondary hypertension is high blood pressure with an underlying cause. Conditions that may cause secondary hypertension include obstructive sleep apnea, kidney problems, adrenal gland tumors, thyroid problems, and use of certain medications, like birth control pills, cold remedies, decongestants, steroids, and over-the-counter pain relievers.
Risk factors for hypertension are often categorized into whether they are modifiable or non-modifiable. The modifiable risk factors are ones that can be changed by the person experiencing the hypertension. These factors include changes in diet, weight, exercise patterns, socioeconomic status, and mental health or stress. For the modifiable risk factors, patient education is critical. Without teaching the patients how to control their blood pressure, they might leave the hospital with a higher risk for developing complications due to the lack of knowledge about their diagnosis. When educating the patient about how to manage their hypertension, we should always be sure to incorporate cultural preferences and the ability to comprehend the level of teachings. Non-modifiable risk factors are the factors that the patient does not have the ability to change. These include age, ethnicity, genetics, and gender. When hypertension goes untreated, many complications can happen. An increase in blood pressure causes severe vasoconstriction and pressure on the vessels of the body. This build-up pressure leads to complications such as heart failure, kidney disease, vision loss, stroke, and sexual dysfunction. Teaching patients about the possibility of these complications is important. It allows them to watch for early signs, and it also helps reinforce the importance of managing their blood pressure.
There are many different types of medications that can be prescribed to treat hypertension. Some of these medications include ACE inhibitors, beta blockers, calcium channel blockers, peripherally acting alpha adrenergic blockers, angiotensin II antagonists or angiotensin II receptor blockers, vasodilators, centrally acting alpha adrenergics, diuretics, and renin inhibitors. Each medication has the potential for their own different kind of side effects, but common side effects for blood pressure medications include orthostatic hypotension, dizziness, fatigue, cough, headaches, weakness. Some important things to note is that you should continue taking the medication even if you feel better. Take the medication as prescribed. Do not stop taking the medication without talking to your doctor. Tell your doctor if you are pregnant, nursing, or planning to become pregnant, and tell your doctor if you have any concerns about new or worsening symptoms. Health literacy is very important when it comes to medications because the patient needs to have a complete understanding of the medications they are taking, how to take them, and any safety precautions they should know about. If you do not assess the patient's health literacy before sending them home with a new medication, you are risking serious harm to the patient if they do not understand how to take the medication. It is important to make sure the patient understands all aspects of their medication.
Low health literacy is related to chronic health conditions such as hypertension. High blood pressure can be better controlled by adhering to the guidelines of the DASH diet, dietary approaches to stop hypertension, which includes reducing sodium in the diet and increasing other blood pressure lowering nutrients. According to the article, Sodium Intake and Hypertension, a large meta-analysis was conducted with 3,230 participants, finding that a modest reduction in sodium consumption for 4 or more weeks results in a decrease in blood pressure in both hypertensive and normotensive participants. Patients with low health literacy may have difficulty understanding the DASH diet without proper teaching, which is why we created a booklet to explain all information. In addition to having the diet written out, it is critical to empower patients by the evidence-based practice of the teach-back method.
Alcohol intake is directly related to an increase in blood pressure. Alcohol contains lots of calories and sugars, which contribute to an increased body fat, weight gain, and poor diet. All of these factors can lead to high blood pressure. Long-term binge drinking can lead to chronic hypertension. It is recommended that alcohol intake be limited to 2 drinks per day for men and 1 drink per day for women. Caffeine and alcohol can cause a sudden but short increase in blood pressure. It is recommended that caffeine be limited to 200 milligrams per day, which is 2 8-ounce cups of coffee. Heavy drinkers should slowly reduce how much they drink over 1 to 2 weeks. Suddenly stopping risks developing severe high blood pressure for several days.
Lifestyle modifications to improve a person's blood pressure includes exercise, diet modifications, smoking cessation, weight reduction, and stress management. Through regular aerobic exercise of 90 to 150 minutes per week, blood pressure can be lowered 2 to 4 points in people with normal blood pressure and 5 to 8 in those with hypertension. Managing the intake of salt, alcohol, and caffeine, or diets like the DASH diet explained previously, can help reduce blood pressure, especially in those sensitive to these types of foods. Smoking cessation benefits not only a person's overall health, but also decreases their risk for hypertension. Losing weight in those individuals who are obese or are at risk for becoming obese is vital to the control of their blood pressure. Management of stress can help control short-term spikes in blood pressure that could be harmful to the health of a person with pre-existing hypertension. Lifestyle modifications can vary depending on the person, their cultural background, and their degree of health literacy. Diet especially is something that varies drastically depending on culture, and therefore modification to a person's diet is going to be different for each patient. And so we as nurses need to tailor patient education around that. Health literacy is also important to take into account because if a patient doesn't know how to read a food label, they aren't going to know what foods are high in sodium, for example, and what foods they need to cut back on.
In conclusion, health literacy is a very important aspect of patient-centered care. It is essential to ensure the patient has accurate information on all aspects of their care. They need to know what conditions they have, important information about the condition, any lifestyle modifications they need to make, the future of their diagnosed condition, any treatments they will be receiving, how to take their medications, and any other important information about their care. It is extremely important that the nurse assesses the health literacy of the patient before providing patient teaching to ensure the patient is understanding the information completely. The nurse should adapt the teaching plan to fully accommodate for the patient's health literacy. The patient's health may depend on it.